Thanks very much, Pip. It now gives me great pleasure to introduce today's first speaker. Dr. Caroline West specialises in healthy lifestyle medicine and is one of Australia's best-known doctors. She aims not only to inform but inspire, always encouraging her clients and audiences to put their knowledge into action. Her areas of expertise include healthy lifestyle, stress management, better sleep, nutrition and weight management, happiness and positive psychology. Her philosophy is simple. A healthy lifestyle anchors wellness, boosts energy, longevity and peak performance. Ladies and gentlemen, please welcome Dr. Caroline West.
Thanks, Glenn. And it's great to be here with you all. Wasn't that drumming before absolutely fantastic? I don't know if you were like me and you realised that maybe you need a few extra lessons in rhythm, but thanks to Tim and all of the drummers. Can we hear it for them again? I just thought that was such a fantastic way to start off today's session. As you heard, my name is Caroline West. Thank you for having me. Hands up those of you who think that you have pretty great stress management skills. Yep, we are coming to you later. Yep, so that's good. Hands up, both hands, if you feel you need a little bit of help. Woo, yep, and hands up if you never put your hands up for anything. I always like to find those people in the room just to let them know that I'm thinking of them. Today is all about you. And it's fantastic, isn't it, to be attending a health conference that's about our own wellness. It's so important. And when it comes to stress management, I think it's incredibly important to actually be proactive, to step forward and to put ourselves at the centre of the wellness model. And I'm hoping to share with you some of the tips that I've gained along the way. I know that there's a lot of collective experience and wisdom in the room, so I'm hoping to be able to tap into that today as well. But I guess if we think about it, we really should be the healthiest people on the planet, shouldn't we? We work in health, we have access to all of that knowledge, information, expertise. We're certainly fantastic at giving advice to our patients about how to have a healthier life, when to have those checkups. So we're pretty fabulous at that, aren't we? The caring aspect of things and really extending ourselves to others. But the big question that I always ask is, how good are we at looking after ourselves? That's the big question. And today is all about looking at that exact question, looking at our own health, wellness and vitality. And hopefully you'll be inspired with a few practical tips that you can take away and embed in your routines starting today. When I get to know somebody, I always like to find out a little bit about them, and today's no different, and I'm hoping today that you'll come with me on that journey and let me know a little bit about yourselves as well. One of the ways that I'd like to do that is starting with a little quiz. And I guess that in my line of work, which is all about health and wellness, I believe that it's very important to move whenever possible. And when we started off today's session, we were moving with the drums. And that was a fantastic way to get into our bodies and out of our heads. So today I'll be getting you to pop up and down out of your chairs. And when you do so, just be mindful to put your hand down so that you don't have even extra activity as you go through. But it's just a matter of, there are plenty of health workers in the room, so maybe it won't be such a problem. But I'd just like you to practice now. We're just going to actually pop up out of your chairs. Pop up. And then just practice sitting down. So this is the first activity of the day. It's pretty straightforward. Did anybody have trouble with that? Remember to put your hand back down as you sit. Now, this is all about connection today too, and I can see that there are a few people at the back of the room that probably sat right up at the back of the room hoping that I wouldn't notice them. Yep, that'd be you. So could the people in the last few rows actually rise up out of their chairs and actually move forward, because I want you to make some new friends and have some connections today. And when you're sort of sitting in the last row, right up in the corner all by yourself, it's going to be quite hard to make new friends. So could the people in the back rows just move forward? Come on, otherwise I'll come up there. Come on, up you hop. You've practiced the standing up thing. So as these reluctant people come further and join the group, I'd ideally like you to be sitting next to somebody. Now, if you're not sitting next to anybody and you're on your Pat Malone, I'd like you to just do the little stand up and move next to somebody. Or those people in the back row are quite... I think we need to give them a few sessions in... they are moving. Standing, moving. Come on. And you could introduce yourself to your new friend. There are a couple of people that are still sitting by themselves up there. Could you just sit one chair closer? Just move along one chair. Oh, yep, that's you. Yep, you with the black top, yep. Come on. You really don't want to sit one, come on. Okay, so let's start the quiz now. And this is, in a way, it's a bit like getting an idea of demographics and really getting an idea of the growth in the room. You know when you see those growth charts, GDP, things like that, and suddenly the chart rises and swells. So we're just going to get an idea visually of who's in the room. So let's start now with a very easy one. Stand up, pop up, sit down if you've got blue eyes. Oh, I had to think about that one. And sit down again. Yep, brown eyes. Yep, green eyes. So up, down, green eyes, hazel eyes, long hair, short hair, oh, no hair. No, okay. Community-based nurse, hospital-based nurse, work in academia or teaching, managerial. You're not actually a nurse at all. Okay. Let's try a few health ones. I'm not going to be asking you about pap tests, mammograms, or when you had your prostate checked, but let's, you can keep that one to yourself for now. Pop up if you did planned exercise this morning. Okay, yep. Okay, it's great to see where there's work, there's opportunities in the room. Pop up if you didn't have breakfast. Oh, okay. So pop up if you did have breakfast. Hey, well done. Okay. Pop up if you're a non-smoker. Whoa, well done. Fantastic. Big round of applause there, isn't that great to see? Fantastic. Pop up if you had more than 7 hours sleep last night. Oh, that's interesting, isn't it? So we've got exercise, we've got sleep. These are the areas. Yep. Take a seat down. Now imagine this scenario. You wake up in the morning, you're feeling a bit fluey, you know, a bit achy in the joints, maybe a bit nauseous. Maybe you've had a bit of a vomit. Pop up if you would never go to work under such circumstances. Okay, stand up if you admit that you probably have gone to work, like that. Pretty crook, yep. Okay, pop down. Pop up if you had less than 2 drinks last night. Alcoholic drinks, I'm talking. Yay! Oh, we've got non-drokers, yay! If I ask you that question tomorrow, it might be a different set of circumstances, because I realise today's a big day. Pop up if you own a pair of running shoes. Oh, okay, great. So, interesting to see the difference. Okay, so you've all got the equipment. There's just a slight bit of a gap between knowledge and intent and action, but we'll get there. Now, this one you don't have to answer unless you would like to disclose it to the audience. Most of you can only see the backs of your heads, but pop up if you haven't had sex in the last week, and that includes sex with yourself. Okay, right, well, we've... Okay, so we've got a few people who weren't quite sure what that question meant. Okay, so pop up if you've been nursing for more than 5 years. Okay, pop down. More than 10 years. Oh, more than 20 years. Oh my gosh. When I talked about collective wisdom, fantastic. More than 30 years. More than 40 years. Oh, a big round of applause for those with more than 40 years nursing experience. 45 years? Anybody 45? 45? 50? 50 years? Oh my goodness, can you just come down, please, from you there with, that's you, yes, you in the pink top. Can you come up quickly, because this is fantastic. And another one, who was the other person? Could you quickly come up? I mean, honestly, you need to be honoured. There needs to be a ceremonial thing here for these 3 fantastic, all of 50 plus years. Pop up, please, just a quick, oh my gosh. That is fantastic. I just need to get these wonderful practitioners up here, and I'm just going to, oh, come on, centre stage. Oh, can we hear it one more time? That is just fantastic. I'm just going to quickly get a pearl of wisdom from each person, because I'm sure that between this group here, we have some wonderful tips on health and wellness and how they've enjoyed such longevity in their career. Just one little tip that you'd like to share, Jerry.
Keep working.
Thanks, Jerry. Well, that sort of sums it up, doesn't it? If you just keep working.
Laughing and walking.
Laughing and walking at the same time.
Maybe laughing. I don't like walking.
Okay, great.
Keep working.
Keep working. So that's whereabouts are you working now?
In maternal and child health with babies and mothers in a day-stay program.
Fantastic, fantastic. And Jed, is it? Jed, what's your tip?
Think of the money.
That's fantastic. We'd like to sum that up. Yeah. Daphne.
Just love your work.
Enjoy your work, yeah.
I'll keep a sense of humour.
We've had that a lot, haven't we? Just stay with Lynn.
Mine was a sense of humour as well.
Yeah, fantastic. And where are you working, Lynn?
Maroondah Hospital.
Fantastic. Whoa, is anybody else from there? Yay! Fantastic. Well, once again, big round of applause. Fantastic. Thanks. Absolutely fantastic. So, interesting, isn't it, to hear about the things that keep us all going in our profession. A lot of the ideas that I'm going to share with you come from my work as a GP. I work in a Sydney practice, and we're right next to St Vincent's Hospital in the King's Cross area. Some of you are probably familiar with King's Cross. It's a fairly nitty-gritty part of town. We have an interesting mix of people. There's a lot of issues around drugs, alcohol, homelessness, mental health. We also do a lot of HIV, Hep C. As the area has gentrified, a lot of new families have moved in, so we're actually doing a lot of antenatal shared care, and we're looking after a far more diverse group than we did when I started there 25 years ago. When I started out in general practice, we were just 2 doctors, 2 filing cabinets. We had a little tiny room that was above a bottle shop, which in the middle of King's Cross was quite fitting, and access was nearly impossible. We fast forward 25 years later, and our clinic has more than 30 people as part of our team. We have 5 nurses, we've got 3 in research. We're very much a collegial practice that's community-based, and we really reflect a lot of what's happened in medicine over the last couple of decades, which is really about team care arrangements and working closely with our colleagues to get the best outcomes. The nurses in our practice, there's one of our nurses there, Elise, are extremely trusted. And when people come to our practice, the first person that they meet is one of our nurses, and that creates a special bond and a connection. And we all work very much, as I said, as a team, and I appreciate enormously the work that the nurses in our practice do. We also have nurses working in community outreach. We've got a drug and alcohol nurse. We have regular meetings with nurses from the mental health team. So it's a very interesting practice that has allowed us to, thank you very much for that. Yeah, and I would also like to see the nurses step further along the way as well in our practice. They're already doing a lot of the clinical work. They do care arrangements and obviously do a lot of the health assessments with our patients, but I believe there's, into the future, an increasing role for nurses in our community practices, and really we should be working far more closely with them, certainly in general practice. So I look forward to working with many of you, and especially as I'm doing a lot of shared care now, and I'm really enjoying working with the midwives at the Royal Hospital for Women. So it's a really interesting line of work. The other part of my life is obviously that, like everybody here, we've all got a backstory. We're not just dealing with work stresses and the conundrums of our 9 to 5 or 9 to 8 or shift work. We've actually got life stresses and interesting lives, as I like to think about it. Outside of work, you know, I've just got married, and we've got 5 children between us. 3 of them are teenagers. I have to say that getting married was one of the most stressful moments of my life. It was a positive stress, but the thing I was most stressed about was, were the teenagers going to behave on the day? So that was a tremendous source of stress. Obviously, a lot of us have elderly parents, so we're sandwiched between responsibilities at home in both directions. But it's always a rich life. We've got lots of pets as well. We've had various cycles of things like rabbits, dogs, guinea pigs. The last of our dynasty of guinea pigs ended not long ago when the builder came over, and this was another one of our family dramas, talking about life stresses. The builder came over with a big, muscular dog, and it was, yeah, this is a true story. It was the day that our very last guinea pig vanished. Coincidence or not, I don't know, but when you call your last guinea pig lasagna, I guess you've got to be asking for it. As I mentioned, a lot of what I'm going to share with you it comes from my experience as a GP, but I have had for more than 20 years a very strong interest in lifestyle medicine and stress management. I work extensively with health professionals, nurses, allied health doctors, when it comes to health and wellness, because I believe that if we're not looking after ourselves and we're not valuing our own health, it's very hard for us to be authentic and to actually have the energy to enjoy our careers with many decades behind us. The other side of my working life, at least, involves the media. And over the years, I've been lucky enough to work for a variety of programs, including Beyond 2000, 60 Minutes, Beyond Tomorrow. And I've got to travel the world for almost 11 years. I was just travelling around the world, reporting, living out of a suitcase. And one of the interesting things about that was I got to meet fantastic people who were coming up with fantastic inventions and technologies. And some of my favourites were, for example, this little baby, which this paediatrician had invented a mobile hearing assessment unit, and he used to just carry it around between his clients in the countryside and open it up and go, "Will you put my baby in my suitcase?" That was a really bad accent. My apologies to anybody here. But if you could just imagine transporting yourself to somewhere in the UK, and this was the sort of thing that he was lugging around. Fantastic invention. I did over the years, a lot of technological stories that involved things like amphibious vehicles like this one. They never quite worked. They either were good cars or they were really bad boats. But it was interesting to see how this was so often a thread that came through and through again. This is an MRI operating theatre. So in real time, surgeons can stand within the 2 loops of the MRI and get a real-time image of where they are in the body. Absolutely fantastic. And I also worked with the creator of Mythbusters, so through my professional career I've also been run over by various vehicles, including this one, which the inventor called the PMT tractor. Yep, the pneumatic mattress tractor. I was lucky to have survived that one. But if we look at the wonderful glitzy world of television and the sorts of shows that always make it to the front, they're shows about transformation, before and after shots. They're shows about breakthroughs. I work currently for the Nine Network, and very often there's a lot of interest in the latest medical breakthrough. But if we were honest and we really wanted to make a reality TV show about what it's really like out there in health, it would probably have to be called Chronic. Can you imagine? Stay tuned for episode 4894 as John moves into year 30 of his journey with diabetes type 2. So I guess that the real world of health is really being driven not by these whiz-bang things, but by lifestyle conditions which are largely linked to how we are living, the sorts of environment in which we are working and spending all of our leisure time. So if we look at the things that are driving that and what's really changed in medicine, when I started out as a medical student, a lot of the focus of our training was about acute conditions. It was about how to manage a heart attack, what to do about pneumonia. It was rarely about the long-term management of chronic disease, and certainly things like mental health were relegated very much to the side. Some of the things that have obviously impacted on a changing world, can you think of some of the things in health that have really made a difference in terms of how we're living, how we're functioning, and these are rolling onto our health? You'd see it all the time with your patients. What are the big things that you think? Yes? What was that? Antibiotics, yep. Yep. What are some other things that have really impacted on health? Yeah. Technology, yeah. So we've got technology, we've got the internet, we've got the cars. What else is sort of really, do you see? Yeah. Transplant, junk food, yep. Lifestyle, yeah. So incredibly changing world that, you know, essentially our genetics haven't changed, but our lifestyle and our environment has. One of the biggest changes of all, obviously we've got things like transport and leisure time, and the types of work we're doing is constantly shifting. But I remember talking to a bunch of women one time about, you know, what do you think are the biggest lifestyle factors and inventions that have changed the world? And, you know, you'd think that they would have mentioned the car or planes, but somebody said, oh no, I reckon it's the elastic waistband. And they reckon that this had a profound effect on our lifestyles, because with the invention of the elastic waistband, clothing became a lot more comfortable, but didn't it? I mean, I wear everything that's stretchy and never needs ironing. I don't iron anything. So I really like some of these new fabrics, but it does mean that we actually don't have anything that gives us feedback often about whether something's a little bit tight, because it just keeps accommodating us for all of our loveliness. Just a moment here to take it back to Jesus. Now, this is in no way meant to be a religious moment for those of you who are or who are not, but it's just really to look at what's happened with depictions of the Last Supper over the last 1,000 years. Now, as you can see, this is a very famous painting, and it has been painted thousands of times. Researchers in New York actually had a look at the Last Supper, and they looked at it over 1,000 years. They looked at 52 different paintings, and they went, what's happened to the Last Supper? What do you reckon's happened to the Last Supper as it's depicted in paintings through the last 1,000 years? Any thoughts? Bigger? Yeah. So that's exactly right. The size of the plates, the size of the goblets, the size of the servings has almost doubled in that period of time, which is kind of interesting because we've seen that same thing happen not just in 1,000 years, but in the last 25. I don't think this would be on the menu, but for the Last Supper, but it's interesting, isn't it, how we've also got to the stage where we're celebrating ridiculous eating competitions. You know, how many hamburgers can you eat in the shortest period of time? And that's entertainment, apparently. So this is really what we're up against, isn't it, with technology? So the technology, the phone's getting so small, it's going to be on our watch in a minute. Well, it already is, isn't it? As things get smaller and smaller, we get bigger and bigger. The other thing that's really changing so much in terms of our health and our lifestyle is this. Now, this is Vaucluse High School. For those of you who know Sydney, it's up near the Gap area, and I, on Sundays, with friends, go for a bit of a cycle up this slow hill. And it's interesting, Vaucluse High has closed down, and as you can see, it looked pretty derelict. The windows are falling off. And it was sold off some years ago because it was felt that there weren't going to be any more high school students, so we didn't really need this high school anymore. But guess what is being built in its place? An aged care facility. So this actually pretty well sums up what's happening, isn't it? That we've got less people coming through, and you know, in the next 20 or 30 years, we're looking at an increase in the number of people over 85 of something like 400%. So our demographic is changing enormously, and that also reflects on us because we're all living longer. And as we live longer, the question is, are we living longer, healthier lives, or are we living longer, less healthy lives? What do you think that answer is? You work in chronic disease, so it's this dallies. So we've basically got this situation where kids, and you'd be seeing this a lot with your kids working as midwives and with early care for children, that they're actually living healthier lives and they've got more information about nutrition and good vaccination programs. And we're seeing that they're really doing very well. They're getting off to a good start in life. If we look at the back end of life, we've got people living longer, but very often people are living with chronic disease for a bigger proportion of their lives. And that also goes for us. So doctors and nurses are just like everybody else in the community. We too have to learn to manage chronic conditions, and they may be in mental health, musculoskeletal, particularly back, neck, hip, knee injuries, and the other risk factors for things like diabetes, stroke and heart disease. So the big question is how we look after ourselves. And as I mentioned, I believe that a proactive approach with embedding a few lifestyle factors that really help you maintain resilience and wellness throughout your lives, working and personal lives, is a really worthwhile investment. I also believe that it's very positive along the way to help by fueling positive emotions. And it's an incredible tool in helping redress that balance with our stress, is to actually focus on the things that we appreciate, that we feel grateful for, having a laugh. And all of those things are incredibly powerful in flipping our mindset and allowing us to focus on what we do appreciate and what is working for us. So it's the strengths-based model. So what I'd like you to do now, and this is why I wanted you to be close to a friend, and I can see that I think pretty well everybody's got a friend now, and if they don't, I'd like them to make one. And what I'd like you to do is just stand up and find a friend, and if you're sort of a lone person and you can't find one friend but there are two, then make it a group of three. So standing up and turning to the person who can be your new friend, and if you don't know them, just quickly say hello to each other, big smile. It's really good to meet and say good big smile. Yep. Shake hands, you know, if you're into the big hug, whatever you do when you first meet somebody. Yeah, group hug, that's it. Now what I'd like you to do, oh look, there's so much love in the room. Now what I'd like you to do to fuel this positive emotion is with each other, I'm just going to give you like a couple of minutes to actually quickly describe one thing that you really enjoy about your work. One thing that really gives you a lift that you enjoy about your work. Okay, off you go now, and I'm going to ring the ringer when you're done. Keeping it positive. I got just 1 minute more, so just a quick... Yeah. Okay, fantastic. So if you could just grab a seat again, if that's making you more comfortable. I'm just going to come down here for 1 second. This gives me a lot of incidental exercise. And I'm just going to find a couple of very positive-looking people out here. You're looking so positive, I couldn't go past you. Lindy and Carolyn. Could you stand up, Lindy and Carolyn? Just a quick hello to the crowd, just, bask in the glow. Yep, that's right. Hello, everybody. So quick, Lindy, tell me a little about what you do.
I'm an enrolled nurse and I work at Inverelgan at Latrobe Regional Hospital, but I work out in the community in mental health.
Fantastic. I mean, I take my hat off to you guys. In terms of mental health, I'd have to say that the mental health nurses that we work with are possibly the hardest working on the whole team, and they really get out there in the community. I'm serious. No, I'm serious. Oh, I'm serious. Oh. No, I'm serious and I depend on you guys all the time. I'm always phoning and having case conferences. What's so-and-so patient up to? And you actually go out to their home and you get to see them in their home environment, which is something that we often don't have the privilege of doing, and that gives you so much context, doesn't it? So they'll report back and they go, oh, look, Jackie's actually doing okay, the house is tidy, she's got food in the fridge, and all of those little things, the social determinants of mental health, the things that you guys know.
In a different light, you actually see the patient, they're more relaxed in their own home and they open up to you.
Yeah, no, it's fantastic. And is that one of the things you enjoy most, Lindy?
It is, and we were just talking about that, what's the best thing about our work, and like those ladies that have worked for 50 years, laughter. And in mental health, if you don't laugh, you join them.
Yeah, they've beat them, join them. That is so true, isn't it? Oh, yeah, we have a belly laugh occasionally that's probably at work best kept to ourselves because it's probably sometimes seen as a bit inappropriate, isn't it? Yeah. Between ourselves. I had a very difficult patient last week, and we just built a new section of our surgery. And this patient, I was running a bit late, and I saw them on the list, and I went, oh my goodness, and really tricky, kind of homeless. They often don't come in, and it was going to be really tough. And yes, as they didn't arrive, there was such a sort of sense of relief that was captured. But it's sometimes best a private moment, isn't it? Yeah. You have to be able to laugh. Carolyn, what do you do?
I'm a community mental health nurse as well.
Oh, big hug, big hug. Oh, fantastic. And what is it that you enjoy?
I enjoy a smile from someone who has chronic mental illness and the privilege of them letting you into their lives and them trusting you to tell their stories, because often they've told their stories over and over again for many, many years. And the rapport that you build with different people and having the time to do that.
It's so important. So thanks so much for that. Yes, but I mean, I think that when it comes to my work as well, some of the most satisfying areas of my work are really getting to know that human side of a story. And certainly with mental health, it's all about long-term care, isn't it? And that continuity of care is so important and special and often leads to the best outcomes. And it's only community teams that make that possible, because the hospital system's so gridlocked and they go in and out of acute care and they can't keep tabs on people long-term. But when you work in mental health, that's one of the most satisfying parts of the work, I think. And if we really look at nursing and the caring professions, very often that comes through again and again, that the good news about nursing and working in healthcare is that sense of purpose, value, connection and appreciation. That even if some patients find it difficult to articulate, there's often a real sense of appreciation that comes back towards you, which is one of the really good aspects of our health. And it's certainly a good news story. What are some of the other things that we may do well for our own health, apart from that sense of having a sense of purpose and time out? Yeah. So are we good at that? No, we're not very good at that. That might be in the bad news one. Yeah. What's some of the other good news when it comes to our health? Exercise, yep. And how well are we doing that as a profession, do you think? Not very well, okay. Too tired, yeah. And what else comes up again and again with the good stuff? What was that? Eating well, yep. So the other things that come up again in some of the research is that we're reasonably good at getting ourselves vaccinated, at doing our preventative health checks. We know all the stuff about exercise and nutrition, but as I'll talk about in a minute, there's often a bit of a gap between knowledge and action, which is one of those areas where I think that we can often find an opportunity to make some changes. The not so good news is that, this is after a hard day, the not so good news is that because we're in a caring profession and we extend ourselves and we're so often interested in the welfare of others, that we often take the eye off the welfare of ourselves. So what increasingly is common amongst healthcare professionals across the board is really that we have all these skills and these qualities that make us really good at what we do. So empathy, caring, sometimes perfectionism, which can be useful because we want to make sure we get the job done well. We have a strong desire to help others, but the downside of that is it's a double-edged sword, that we're very good at extending the care to others, but we're not always very good at extending that care and kindness to ourselves. So today is all about being proactive, and I have to say this program itself, the wellness program, is an inspiration, and I think is actually a leader in Australia in terms of what's on offer for you today, because it's really about being proactive and about putting it on the education agenda and embedding it as one of those essentials, not just an add-on. This is an essential, and I think that that is incredibly kind of inspirational, and it's also at the front of the curve in terms of trends around the world. So well done to Glenn and to all the team for putting on today. It's fantastic. Some of the physical signs of stress, though, that we'll talk about, I'd actually like to get... Now, earlier today I met a new friend, Heather. Where's Heather? Is Heather here? Oh, Heather. Would you mind popping up, Heather? No, so Heather... I'd just like Heather to help me out here because it's probably easier to demonstrate with Heather's assistance. She has no idea what I'm going to ask her to do yet. Fantastic. I guess you're all sitting there going, oh, I'm glad that wasn't me. Come across here, Heather. I'm not going to get you to play the drums or do a dance, but could you just quickly draw... Hi, Heather. Could you just say hello, because I don't know if everybody knows you.
Hello, everybody.
And Heather, what do you do? Can you fill us in?
I'm the CEO of a recovery-focused program in the community for people with drug and alcohol and mental health.
Fantastic. So this is this will be a bit of light relief along the opposite end of the spectrum. So if I could just get you to get a texter, and I was just wondering if you could draw for me your impression of a cave woman. A cave woman. Just any, it could be a stick figure. Just give us your best, Heather. Oh, but maybe if the AV lovely person could actually hone in on Heather's drawing here, so that we can see what's happening on the screen.
And she'd have a shield.
She'd have a shield. So we've got the. Okay, and what else? And does she have a name?
She's Henrietta.
Henrietta the cave woman. What else might be in Henrietta's life, do you think?
A caveman.
Yeah, okay, so you could just quickly draw a caveman there, just on the corner. Okay, so the caveman's somewhat diminished, but yeah, and he's the only one he's the only one wearing a loincloth. Henrietta seems to be going freestyle here, but thanks very much for that. So what we have here, you're probably wondering what on earth this is doing on the paper here, but this is a symbolic representation of us as humans. That's Henrietta, and thanks for that, Heather. So a big round of applause for Heather, who's been an artist in residence. But if we have a think about Henrietta the cave woman, and we think about what was in her life and what she was up against, She might have had various stresses to deal with, and a lot of them would have been along the lines of defending herself against predators. And when she defended herself against a predator, what would she have done? Yeah, fight, flight. And what gets released during that time of fight and flight? Adrenaline, yeah. And what does adrenaline make your body do? What are some of the things that happen to your body? Heart racing, sweating, pupils dilate, you're not thinking about your Christmas wish list, you're very much focused on the moment. Metabolically, there are a lot of changes that happen in terms of what floods into your bloodstream, glucose, lipids change, mental functioning changes. So there's a lot that happens. What about our musculoskeletal system? Where do we feel it? Shoulders, and just put your fingers here at the front of your chest and just have a feel in those muscles there. Are any of those feeling tight? Because often that's the fight and flight, that we're used to sort of doing this. So because we're trying to fight off a predator, we get it in our necks and upper backs and our shoulders. What's worth thinking about with stress is that in order for us to manage our stress, we have to be aware of how it's impacting our bodies, because sometimes we're not only good at not taking good care of ourselves, we're very good at denial. And I think that one of the things about stress is it's important to take our awareness into our body and go, that's interesting, I'm feeling a bit tight this morning, or I'm noticing my mouth is a bit dry, or I'm noticing that that's interesting when I see a certain patient, my heart goes a little faster. There could be all sorts of physical manifestations of stress. But there are other consequences of stress as well. If I can go back to the slides again. Obviously, stress has a big impact on the brain, and those fear centres in the brain around places like the amygdala actually start to fire more intensely. But we also get these behavioural signs of stress, and we may not even realise that we're going through them, but particularly black and white thinking, where we become, when we're more stressed, more rigid in our thinking styles. We make more mistakes. We take longer to come to a decision. We might start to ruminate. So these are some things we may observe in ourselves, or we may observe in others. Often women in times of stress, which is a little different to men sometimes, actually when they release oxytocin, have a stress model that results in tend and befriend, where there was a survival instinct for Henrietta to actually make a clan type arrangement with somebody at a time of stress to shore up the contents and the people within the cave system. Also emotional signs of stress. So it may be that you take your stress home, that you're actually very contained at work and you're very good with all of your patients. But then basically when you're in situations of stress, you take it home. So some of the burnout signs can be dreading to see patients, chronic complaining, even fantasising about a change in career. And if you experience some of these, then it's worthwhile stepping back and thinking about some of the things that you can do in terms of self-care. One of the biggest stress busters, I think, of all is really along these lines of making a plan and actually having some goals set around that plan. And the number one thing that I always suggest for people's stress levels to start with is really in this scheme of diet, exercise, sleep and mindset is exercise. And it's thinking of exercise as an opportunity, not an inconvenience. So it's really thinking about what are some ways that I could increase the amount of activity that I do. Because all of us have fairly sedentary jobs, even if we're being active before and after work, unless we're sort of moving around a lot on staircases, even just moving around a surgery or a ward, you often feel as though you're moving a lot, but when you track yourself on something like a pedometer, you may not be doing as many steps a day as is optimal. Most people, when they have barriers for exercise, think about time and energy. So one of the things that's really useful with exercise is to embed it in your commute wherever possible. In my example, I'm very busy, but I try to get to work either by cycling or on foot, or if I catch the bus, I make a pact with myself that I'll walk half the distance and catch the bus for the second half. And that means I'm less likely to flick the exercise because it's actually embedded in my day. What often happens is people leave the exercise session to the end of the day, they're more likely to flick it. So having some sort of planned exercise that you're doing in the mornings often is useful, and putting aside your gear the night before. So just as you'd prioritise and commit to other things on your to-do list, making exercise one of those things that really is an essential. As we get older, past the age of 25 really, having 2 sessions a week of some sort of strength-based activity also keeps our muscles in good shape and strength. So without that strength-based training, we often start to lose muscle, and we're more likely to have injuries when we're moving, lifting, carrying. So all of these things, it's a matter of finding often somebody that you can do something with, or something that's going to suit your particular schedule, but making sure that you start to have a few goals with moving. The other thing is that this London bus, if you think about the sitting-standing conundrum, and I'll get to this London bus story in a minute, but one of the things, how many people, just a quick indication with hands, how many people spend a good hunk of their day sitting? And that would be television and, yeah. Okay, so quite a few of you are quite active and but what I'd like you to do now is this thought of that there's research that's come out that shows that if you move for 2 minutes every 20, you reduce your risks of diabetes type 2. And so what I'd like you to think about today is that every 20 minutes, if you're sitting watching the television, that you're moving for at least 2 of them, where you stand up and you get out of the seat. Because metabolically, we were never designed. Henrietta never sat down for very long. She always had something to do. So what I'd like you to do now, and this is a thought of sort of moving, because it's really good to just keep moving through sessions. I'd like you to stand up again, and this is a sort of something you could do at work, possibly if you're feeling a bit kind of as though you need to move out of your chair, or maybe when you're watching television. Does anybody remember Mr. Squiggle? Okay, for those of you who don't know Mr. Squiggle, anybody that doesn't know Mr. Squiggle? Yeah, okay. Mr. Squiggle was a character, and he had a great big long nose made of a big pointy pencil. And he used to be given a partly done drawing, and he had to fill in the rest of it. So what you're going to do now is you're going to channel Mr. Squiggle into your body. But this time I'd like you to imagine that great big pointy pencil with the pointy bit away from you is just nestled between the butt cheeks here. And I'm just going to do you to get to do an M, Mr. Squiggle, and we're just going to spell out a few words on the seat. So we're going to start off, and this is just going to get everything moving. So we're going to spell out the letter M, M-O-V. I'm hopeless at this. You can see I'm just going round and round. E, Y, O, U, R. And then I just want you to make up a word at the end. Off you go. Do an imaginary word. It's got to be move your... What was that? Ask. Oh, okay. Fantastic. So I want you to think about that. So when you're between things, I just want you at the front of the TV, a bit of this, a bit of that, just, to loosen things up. You can all just grab a seat again. And that's probably given you many extra minutes of your life. So it's worth thinking about how you can move. After Second World War, it became pretty apparent that there was something in this moving thing, and it's taken us a really long time to sort of embed it in modern medical practice. We're very slow learners. A guy called Jerry Morris, back after the Second World War, noticed that bus drivers of London buses were much healthier. They were much less healthy than conductors. So the conductors that were going up and down the stairs on and off were actually living longer, getting less heart disease and dying much less right across the board. So what I'd like you to think about, and this is something to encourage in your patients as well, is this idea of moving through your day. One of the things that I do that I'm experimenting with is having a part standing desk. Because sitting all day is basically taking years off our lives. One of the things I'm doing is you can get standing desks that move you up and down. It's not just about standing, it's about sort of moving. So can you remember what I said before about every 20 minutes, how many minutes do you move? 2. And you don't have to run up a flight of stairs, you just need to shuffle. Go and do something. The other thing is, if you don't want to get a standing desk, which costs $300 or $400, I've just got one of those IKEA boxes, the stools for the kitchen, that's about this high, and I just pop that on my desk and put my computer on that. And I rigged up something at my workstation in the surgery, except that the thing that I rigged up was actually a wine box. And I had to, in view of that didn't go down particularly well with the patients, I had to change that. But you can use anything you like that helps. The other thing that I do, which I think helps enormously, does anybody have an exercise tracker on their wrist? A Fitbit or a Garmin or a Jawbone? Yeah. So these are fantastic little devices. If you've got one in the audience, just hold it up and people can have a look at them. They're just like this little rubber wristband. It's got an accelerometer in it. And basically it communicates with your mobile phone. I just took this one a couple of days ago off mine. And it records how many steps you're doing a day. And the great thing is it brings your attention and mindfulness to how much exercise you're actually doing and how much activity. It's good to do bursts of activity, but it's also very good for your health in terms of mental health, stress relief, to actually be moving. There is a high correlation between increasing your physical activity and improving your long-term health. So I guess today you're going to be hearing from some other speakers on topics like mindfulness and really the value of bringing your attention and awareness into the present moment and starting to have that conversation about ways that you can improve your health and wellness. They may be by having a conversation with your GP about having a checkup. It may be about finding a friend that you can have a laugh with at work, or celebrating the positive aspects of your work, or making some time to actually embed some more exercise and movement into your day. When it comes to stress management, it's about being proactive, and there are so many little ways that we can get that started. In my area, I think that the health of ourselves is incredibly important because there's lots of evidence coming through that we're more authentic with our patients if we're doing a health behaviour ourselves. So if we walk the walk, if we actually exercise, if we choose to eat healthier foods, if we choose to prioritise our sleep, if we choose to take time out, we're more likely to pass those messages on to our patients, and it creates a virtuous cycle. So when we walk the walk, we pass those messages on to our patients just by default because we're walking the walk, we're authentic, and we're enjoying the journey. There is so much experience and wisdom in the room, and I'm hoping today will be all about making connections with new friends and people and sharing some ideas about how you too can look after your health and make it a priority. It's been fantastic to be here with you, and hopefully this is just the beginning of your journey towards wellness. And I hope that you will take back some ideas from today's conference and really start putting them to good use in your daily lives. It's been fantastic to hear from everybody today, and thanks for participating. And I'll be around for the rest of the conference because I think it's such a hot program that I'm keen to hear from the other speakers and really share some ideas today. It's fantastic. So my name is Caroline West. I'll be around. Come and have a chat. And I look forward to seeing you again sometime soon. So thank you very much.